Hello, everyone, and welcome back to the Meet the Members series. Today we have with us Love for Air Foundation. So please, could you introduce yourself and tell us what your foundation does?
Hi, I'm Shane Fitch. I'm CEO and founder of Lovexair Foundation, which was established 10 years ago to improve the outcomes and offer meaningful solutions in self-care for people affected by respiratory conditions, or now, of course, with COVID sequela. And the importance of clean air forms also a key pillar of what we're working on for all stakeholders, for citizens as patients, for healthcare professionals, organizations, and all our partners and networks.
Okay, sounds good. And well, what makes your foundation stand out from the others?
We've developed a specialized trained team to manage the patient journey better, which can focus on specific diseases or aspects of self-care, which can really make a difference to people's quality of life and understanding how to manage themselves in this new paradigm of what we call blended care, which is between home and clinical setting. And as we know, with the disconnectedness, particularly now with the pandemic, it's even more important to have people and digital resources where we can manage and help people to overcome their issues and understand better how to work with apps, devices, and their own self-monitoring. So we can carry out proof of concept studies in home clinical settings for these new models, supporting the healthcare professionals in hospitals and the people with the disease management issues. So we work closely with real clinical experts. We work also in authorized studies in hospitals to get clinical validation on the way we're working, and also in pharmacies or in polyclinics, online and offline, and in events and activities, which are just beginning to start again, fortunately. And that's, I think, where our key specialized competencies reside.
Okay, sounds amazing. And well, what has been your foundation's biggest success or biggest failure?
I think our biggest success has been working together with a really big international partnership with pharma industry globally and nationally,
Mhm.
other IT companies specializing in behavioral scientists, and developing and deploying together a virtual assistant for asthma management, asthma education, I would say, more than management.
Mhm.
On the failure side,
Mhm.
is believing that the IT partnering that we've had in the past is always meaningful
Mhm.
and socially responsible, when unfortunately we're often used as a commodity because we're a patient organization. And as IT partners, they can be more interested in exploiting their own interests instead of recognizing the value of strategic development and, let's say, the consistency and solid support we need in approaching care with creativity and having a real operational value. Because unless we get operational efficiency, we can't develop suitable care support for public and private partnerships.
Okay. And well, let me ask you, what made you join Barcelona Health Hub?
Oh, we've got a long-standing history. I've been in patient advocacy for 23 years. My son was born with a rare disease. So I was at the very beginning of digital health. That's why I set up the foundation. So I worked early on with Health 2, with European Partnership in Active Healthy Aging, with Healthio, and well, Mobile Congress, of course, early days, recognizing that Barcelona has always been a dynamic environment to promote and support digital health futures. And since the early days, really. So for us, staying with Barcelona Health Hub is actually important.
Okay, sounds good. And well, what do you expect from us towards the future?
Well, right now, what we need is we're looking for our own in-house development team because of the issues I've explained, and finance to go one step further with HappyAir. That's our digital ecosystem. So we have a blueprint, actually, which we developed in the last year and a half with multiple stakeholders, hospitals, an AI partner, the behavioral scientists who we worked with previously, and uh, industry partners, big industry partners for public health, to develop an intelligent ecosystem for respiratory diseases through a Horizons 2022 consortia. So what we need now really is to make some changes in our ecosystem in readiness for this project. And also because the partnership is very strong, it's very attractive. Nobody's really done a respiratory intelligent ecosystem. So we want to reach out for private funding as well to begin to get the ball rolling.
Okay, sounds good. And well, is there anything else you would like to tell us that we haven't asked you?
Yes, actually. Why foundations led by patient organizations should be taken seriously as key stakeholders in the digital health era? That's the question. So the answer is because if we have a highly developed knowledge about multi-stakeholder partnering, IT, compliance, and trust, we have our NDPO officer, resources, and trained healthcare professionals who can work with us on social, clinical, and digital health literacy with patients and with healthcare professionals. Mm-hmm. We can really develop very powerful resource partnerships, a people resource center, which can actually change how we develop sustainable health solutions, meeting these SDGs effectively and creating a win-win for all the stakeholders in healthcare. And that will help us get to affordable care.
Definitely. Okay, sounds really good. Thank you so much for your time, and hopefully we'll be doing more activities together towards the future.
Thanks very much, Julia.